So, hello everyone, I'm Brian Adrano, and for this video I will be performing the administering cytotoxic drugs. So, the materials needed are the IV line, assuming that this is an IV line and IV port, and also the drug itself, the cytotoxic drug that physicians ordered to the that will be input to the patient, and then the syringe for the IV push, alcohol swab, assuming that this is alcohol swab, kidney basin for the discard of the alcohol or the cotton balls. So, in the preparation, before doing the procedure, we must prepare the patient's comfortability, and we will provide the patient's privacy, and also uh, we must secure the consent to the patient that he or she agree to this procedure. And also, we must know the exact amount of the drug that will be giving to the patient, because it is it is a cytotoxic drug. So after the preparation, we must assess the patient, the height, weight gain, the patient skin integrity and all, and possible infection in the IV line, in the injections, and in the uh, IV site or the injection site. So after we assess everything, right, we must move to the procedure. Uh, so cytotoxic drug has two different kinds in performing to uh, in giving to the patient. One is the oral route, or the oral drug by cytotoxic drugs, or in the second is through IV push or slow IV intravenous infusion. So for this video, I will be performing the slow IV infusion. So this is the IV line, and then this is the IV port and the drugs. So before we insert or the push the drugs that is needed, using the alcohol swab, make sure that the IV port is clean before we input the cytotoxic drugs. And after this is insert and slow IV. Take note that this drug is the physician's order, and we have the exact amount that is needed to be given to the patient. Okay, so slow IV infusion, input, push, push, push. Now, if there is a blockage, or you can push the syringe easily, there you must assess the IV line. But if the IV line is out of line, or there is a bulge in the IV. Then after administering the cytotoxic drugs, let ask the patient of the comfortability and what the patients feel in that procedure, and then document everything that is given to the patient, and the amount of the drugs that is given, and take note of the date that we administer the cytotoxic drug on the patient. And also, we must secure and follow the 10 rights rule of the patient. So, after administering it, document everything that is done by the procedure, and notice the precision. So, that's all for administering cytotoxic drug. Thank you for listening and watching. See ya.